All right, so I am Lauren Robbins, occupational therapist and lymphedema therapist here at Nebraska Cancer Specialists. And this afternoon I will be talking about lymphedema, precautions, treatment, and what it might involve if you see one of our lymphedema therapists. Here at Nebraska Cancer Specialists, we have two therapists who are certified in lymphedema therapy. Myself, as well as my colleague, Gianna Howard, as well. So our focus for today, I'd like the audience to be able to define lymphedema, name at least 3 signs and symptoms of lymphedema, and verbalize how to treat and manage lymphedema. An introduction. There are currently more than 13 million cancer survivors in the United States as of MD Anderson's 2016 statistics, which is mind-boggling. And by the year 2020, that number is expected to exceed 18 million cancer survivors. 1 in 6 people over the age of 65 is a cancer survivor. 64% of adults diagnosed today can expect to be alive in 5 years, which is wonderful, and it continues to increase with survival rates. Specifically for breast, prostate, and colorectal cancers, it exceeds 90% of a 5-year or more survival rate. 1 in 3 men and 1 in 5 women will be diagnosed with cancer in their lifetime. So why do I start with this? It's because cancer is prevalent. We are always knowing someone personally affected, family members, caregivers. Everyone knows someone who's been impacted by cancer. And then as a lymphedema therapist and as an occupational therapist who specializes in cancer, this is huge. By 2020, over 18 million people will be survivors, meaning we can help that many people with side effects. And one of those side effects we will discuss today is lymphedema. So what is the lymphatic system? I could spend an entire semester lecturing on just the lymphatic system. So for the purposes of today, I will give my spiel on how I like to describe the lymphatic system. I like to say it's our sewer system of the body. It gets rid of the extra cellular gunk, cellular fluid. It's part of our immune system. It helps process all of those fluids for us. It is absolutely essential to human life and plays an integral role in our body's overall health and wellness. Yet many well-educated individuals are not as familiar with its main function and how important it is. The lymphatic system is certainly a complex network of vessels, tissues, organs are involved. Fluid is absorbed in kind of a one-way valve system that lacks a pump. So I like to say it transports fluid in a highway transport system. So the lymph vessels are kind of like your highways. The lymph nodes would be the toll booths along the highway, and they filter that fluid and send it on wherever it's supposed to go. In more detail here, the lymphatic capillaries, lymph flows to the larger and thicker lymphatic vessels. It continues on to the trunks, and then finally, the largest vessels are our thoracic ducts located up here near our heart and kind of by your clavicles, let's say. So they would drain back into your circulatory system, or our kidneys actually excrete the harmful toxins, if you will, through our urine. So this slide gives a little bit more detail into how the lymphatic system does that. Like I said, I'm a visual person, so I like to picture a highway transport system of fluid flowing throughout our body. with the lymphatic vessels being the highways again, and the lymph nodes themselves being the toll booths along that highway. Here is a picture depicting that idea. So these lines would be your lymphatic vessels, and the little kidney bean shaped bundles, and then you can see in the armpits, those are the lymph nodes that kind of act as the toll booths along the highway. In addition, we have organs that are involved, including the thymus, spleen, our tonsils. We have Peyer's patches, P-E-Y-E-R, apostrophe S, and those are in our digestive tract that are all involved in filtering and transporting the lymphatic fluid. And then in anatomy textbooks and things, you'll see it depicted in green versus the circulatory system, which is red and blue. But it follows kind of that similar tracking. So what is lymphedema then? Lymphedema is a swelling of a body region that is resultant of some kind of damage done to your lymphatic system. It is progressive, it's chronic, and there is no cure. It occurs following an injury or disruption to the lymphatic system, making it less efficient for collecting and moving that fluid along. So if we go back to the highway transport system metaphor, let's say you had lymph nodes removed from your right armpit. I like to say now there's road construction in that right armpit. So there is a potential for that fluid or that traffic to get backed up in whatever region it might be affecting. And then here's a visual depiction of the different stages. You can see stage 1, not a whole lot of difference between the right arm and the left arm. Stage 2, a little bit of a difference. Stage 3, definitely. And then stage 4, elephantiasis, quite a bit larger than the other extremity. The lymphatic system is progressive, however, it is very slow. So it takes a significant amount of time to get to these later stages, which is why as lymphedema therapists and healthcare professionals, we want to try to see individuals as soon as possible upon some kind of damage or disruption to the lymphatic system. Some lymphedema facts. Incidence worldwide is actually the result of a parasite, and this is called filariasis. It affects about 90 million individuals. This happens when, usually around the equator, individuals will be bitten by mosquitoes, and larvae enter their lymphatic system, make house kind of in their groin area, further develop, they create a lot of scar tissue and things get backed up. So that's actually the largest incidence worldwide is from a parasite. Breast cancer is approximately around 20 million-ish. And then primary lymphedema is that you were born with a lymphatic system that is less efficient, and that's around 2 to 3 million. A couple of statistics here. Lymphedema occurs in about 50 to 70% of women who have had axillary lymph node surgery, severe in 10%. That's from the Breast Cancer Digest of 1984. Other individuals or research sites, the percentage ranges from 7 to 63% of women being affected. Generally, around 20% of persons with breast cancer will develop lymphedema. Cancer and cancer treatment is the most common cause in the United States. The reason why I include these statistics, because that is a very wide range, 7 to 63%. 50 to 70%. These numbers are very inconsistent. The reason why I include that is because the consensus on when and how to diagnose lymphedema is inconsistent. There's not a hard and fast rule on when, and there's not a hard and fast rule on how to specifically diagnose. Anytime an individual has sustained a disruption to their lymphatic system or damage to their lymphatic system, it puts them at risk to develop lymphedema for the rest of their life. So it could be 3 months before they notice some swelling. It could be 30 years. And that's what makes it difficult to diagnose. In addition, you can develop lymphedema in any area of that quadrant that's affected. So, for my ladies who have undergone breast cancer surgery, if they had a lumpectomy on the right breast may develop lymphedema, but not necessarily the right arm. Or it could be more in the posterior bra area, could be more in the chest wall, the armpit, not necessarily the arm. And so sometimes healthcare professionals miss that because they're looking at the arms in comparison, comparing them, and not necessarily asking about the breast or the chest wall, or same thing with lower extremities, the pelvic region, the abdominal region, the buttock. Sometimes we're looking at just the ankles and comparing those. Lymphedema can occur anywhere in our body except for the pinky toe. And the reason for that is that we just don't have a lot of vascularity going on in the pinky toe. There is no pill or diet currently for lymphedema. There is no cure for lymphedema. Once you have it, you must manage it for the rest of your life. I choose my words wisely here. Once lymph nodes have been removed, once they've been damaged, that cannot be reversed and they cannot grow back. So that means that you're at risk, or you must pay attention and manage it for the rest of your life. There is quite a spectrum on individuals from those pictures of the different stages, from mild to severe, and it may even fluctuate within that. However, once you have it, you must manage it for the rest of your life. The lymphatic system is chiefly responsible for maintaining our internal fluid balance. So again, it is absolutely essential with human life. And it recirculates about 3 liters of fluid every day for us. Think about a 2 liter of pop. It's doing that for us plus every single day. Yes?
So what, with the lymph nodes being gone, is that prohibiting the fluid from moving, or what actually moves the fluid?
Okay.
I know you said it goes through the lymph nodes, and the lymph nodes, kind of, tweak that fluid, but what's actually drawing the fluid?
Sure. Good. We'll go into a few slides on that as well. How the lymphatic fluid actually moves is a few different processes. The lymphatic vessels themselves collect the fluid simply by gravity, simply by pressures, internal pressures that push it into the next valve, let's say. And then also our muscles. So it acts as a muscle pump. So everyday functional kind of movements are moving and flushing that fluid. And we are designed for that lymphatic fluid to continue to drain to its designated lymph bed. So if it's my right arm that's affected, my right arm, chest, breast continues to want to drain to my right armpit, even though I've had those lymph nodes removed. And that's why the fluid gets backed up, because there's nowhere for it to go unless we go into lymphedema treatment and tell it where to go. Does that make sense? Okay. Again, I could spend 3 months talking about these things in detail. So there's a lot of involvement. So here, this may answer some of your questions, Sharon. Going into a little more detail on lymphatic system anatomy. So again, I mentioned it consists of lymph vessels, organs. It produces lymphocytes, which is part of our immune system. Lymphocytes are the ones actually that recognize the foreign cells, substances, microbes, cancer cells. They destroy those and eliminate them from the body. So the lymphocytes are doing that and breaking them down, which is part of the lymphatic fluid. The lymph organs include lymph nodes, lymph vessels, the thymus gland, spleen, tonsils, and the Peyer's patches. Those are all involved in filtering. Think of them as that. And then another good picture there to kind of visualize. The lymphatic system physiology. So lymphatic system absorbs, transports, and recycles cellular proteins from the interstitial space. The interstitial space is kind of that no man's land in between our multiple skin layers, and then you've got blood vessels and things like that. So it's kind of that in-between space. This process occurs through microcirculation, diffusion, osmosis, and various pressures on the interstitial tissues. I like to think of it as the beans analogy. So when you get dry beans and you're going to cook them for chili, you have to let them soak overnight, and then you can put them in your soups and do whatever you're going to do with them. So if you soak them overnight, what happens? They absorb that fluid, and then they're nice and plump and all of that. If you let them continue to soak for another day, 2 days, eventually they're going to break open. They can only absorb so much. If you let them soak overnight, they plump, you take them out, and there's still liquid in the bottom of the bowl. So the lymphatic system is doing that process for us. It's absorbing that fluid, it's filtering that extra fluid for us, sending it back into our circulatory system, or kicking it out, that excess, through our urine. So it's kind of like we're the dry beans, and it's handling all of that fluid for us. Does that help with kind of explaining? I mean, some of this stuff you can go back to 7th grade science with diffusion and osmosis and all of that kind of stuff, but the gist is that it's handling all of those fluids that are pumping through us all day long, and then kicking out the excess. And it's the one that decides, yes, keep that, nope, get rid of that. Okay? Just a few terms. Now again, I like to give individuals some scientific, some anatomy terms here, but I certainly don't expect everyone to be a lymphedema therapist. Ultrafiltration is the fluid leaving the arterial side of our capillaries, and then here is a picture of that. So we've got your vein, your artery that are connected, correct? Again, going back to like 7th grade science and anatomy. In between, we have our lymphatic vessels. So they're all in the same area, and they're communicating each other, various pressures that are going on to maintain our blood pressure and our blood capillary pressure are affecting our lymphatic system. Lymph fluid is the fluid collected from the interstitial space, kind of that no man's land here. That includes the lymphocytes, cellular proteins, water, some fats. Transport capacity is the total amount of lymph the lymphatic system can handle. Lymphatic load is the amount of proteins and fluids. So that's the actual amount that your body is processing during the day. So I think of it as transport capacity is your ceiling. That's the absolute amount that your lymphatic system can handle, whereas your lymphatic load is right here. So we have a built-in safety valve. Now, I get pregnant. I gain some weight. It put me very close to my ceiling because my body is designed to only handle so much fluid, and that varies from person to person. So maybe my ankles swell. Maybe I feel a little puffy everywhere. I have my baby, I lose the weight, and I go back down. Still have that safety valve. An individual who has had lymph nodes removed, surgery, or were born with a lymphatic system that is less efficient, bam, you're right up against your ceiling. And that's why you're at risk. So you no longer have your safety valve because of that surgery, radiation, or simply by genetics with birth.
Would weight loss though bring that down?
It can help.
Okay.
It can certainly help, yes. Absolutely. You can't undo the surgery and the radiation, but absolutely help your lymphatic system out. Mm-hmm. Again, a lot of text on this one. We call them inefficiencies of the lymphatic system. So this can occur with, like I said, the lymphatic system is functioning appropriately when the amount of fluid and the lymphatic load is less than your ceiling, your transport capacity. So when you are hovering here, life is good, you don't even notice that you have a lymphatic system. Things are moving along just fine. When your lymphatic load exceeds your transport capacity, that's when you have lymphedema. So it can either happen with a dynamic insufficiency. So that's when the lymphatic load exceeds your ceiling in an intact lymphatic system. So no surgery, no radiation, no damage has been done to your lymphatic system. It's still there. You have all your lymph vessels and lymph nodes. However, some kind of medical condition, for example, chronic venous insufficiency, generalized edema, maybe when a limb has been dependent for a while and you notice you've been sitting and your ankle swells a little bit simply because gravity is pushing it down and not able to pump it back up. However, you rest your legs and put them up at the end of the day and everything is back to normal. A mechanical insufficiency is when the lymphatic load exceeds your ceiling in a damaged or compromised lymphatic system. So those are my individuals who have had surgery, radiation, or were born with a lymphatic system that's less efficient.
Okay, and maybe this
You're
isn't
fine.
the time for this question, but when you mentioned, you know, like the pregnancy or,
Mhm.
you know, or sitting for a while or, you know, even like if you're walking and you're, you know, swinging of your arms,
Yep.
your hands swell, or
Yep.
your ankles swell. What's the difference between that type of swelling
Mhm.
and then being able to see that swelling go down
Mhm.
versus lymphedema swelling?
Okay, a couple of things are different. One, it could be that that swelling is more water-based. So it's simply in a dependent position and fluid is getting stuck, let's say, out in your dependent extremities. So if it's water-based, it's a little bit easier because when you just raise it back up, gravity will help it flow because it's water-soluble, so it can run in and out of tissues very easily. So that's one reason. If you're in a system where no damage has been done, your lymphatic system can catch up. So laying with your feet up, elevating your arms, something like that, easily, okay, the lymphatic system can catch up. Thanks for the little assist, and now we're good. And the other difference with lymphatic fluid, it is primarily protein-based, so cellular proteins, which means it's too big to just float in and out. It has to be manually moved by the lymphatic system. And then in a system where things have been damaged, it makes it harder for the lymphatic system to do so. It can do it, because you maybe even notice, sometimes I feel a little puffy, sometimes I don't. After Lauren gives me a manual lymphatic drainage, I feel great, and then a week later it's kind of back. It can do that. It can handle that fluid, but it's having a harder time because it doesn't have that system intact like it did before. Does that help?
Yes.
Okay. Here are the stages of lymphedema. So we've got stage 0 or latency. So that's once the damage or disruption has been done. You are automatically in stage 0 or latency. Your ceiling, your safety valve, has been reduced. There might not be any visible swelling, but maybe you have subjective complaints. It feels achy. The extremity feels heavy, full, those kind of things. Maybe a sleeve is fitting a little bit tighter, jewelry is fitting a little bit tighter. You just feel puffy. Those are the kind of complaints that individuals might have. Stage 1, you start to have accumulation of the protein-rich lymphatic fluid. Pitting, meaning you can put your finger in it and it leaves a little dent. However, it reduces with elevation, or it goes down at night. When you wake up in the morning, yeah, my hand and arm looks pretty good. But throughout the day, it starts to feel puffy again. Stage 2, still accumulation of the protein-rich lymphatic fluid. You might have pitting that's a little bit more progressive or more difficult because it's a little bit more firm feeling. It no longer reduces with elevation. That's the big key for stage 2. And then stage 3 and plus is, like I said, elephantiasis, the really large extremity. You might have skin changes where the tissue might feel quite firm. And it might even be so firm that you can't even push into it. So it's non-pitting. Treatment for lymphedema involves 2 phases. The active phase could be daily or multiple appointments per week, which could include manual lymph drainage massage, multi-layer compression bandaging, skin care, and exercises. The maintenance phase is usually less frequent appointments, but individuals must adhere to their self-care home management program. However, that's determined between the individual and their lymphedema therapist. Manual lymph drainage massage is just like it sounds, manually moving that lymphatic fluid wherever it's getting stuck to another area of the body that can help absorb it and get rid of it like it should. With the highway transport system analogy, if I have road construction in my right armpit, I'm going to detour and utilize my left armpit, if possible. Detour and utilize my right pelvic groin area and my tummy to encourage the fluid to flow to these other intact and healthy areas to manage that fluid for us. Compression involves either compression garments or multi-layer compression bandaging. They both act in the same way. There's a gradient. So highest compression would be down by your wrist in your hand. or your ankle and your foot. And then the lowest compression would be up by your armpit to help move that fluid. And then same thing on your leg, either to your knee or your thigh to help move that fluid. Skincare is quite important because we want to prevent infection. We want to help out the lymphatic system as much as possible. If you think about a pond that's not circulating as well and it gets kind of boggy, potentially that could happen in a lymphatic system that's damaged because things aren't flowing. And then lastly, exercise and activity. Again, the lymphatic system does not operate with a pump like our cardiovascular system utilizes the heart to pump fluid, so it relies on us moving around. Doesn't have to be anything crazy like marathons or CrossFit. Just your everyday walking, those kind of activities. So manual lymph drainage, we're working on moving that lymphatic fluid, improving lymph circulation. Lymph angiomotoricity is a real fancy word for thrusting that lymph fluid along. So when I give someone a manual lymph drainage session, I stretch, give a little bit of torque, and that's why. So when I give it a little bit of torque, it thrusts that fluid forward. Special strokes also help to break down any tissue that might be a little bit more firm. And then it has the relaxation and analgesic or reducing pain effect with the therapeutic touch as well. Compression bandaging reduces that ultrafiltration or that kind of leaking out of the fluid we talked about earlier. It improves the efficiency of your muscle pump to help pump the fluid along, and then it prevents accumulation of the fluid that you just moved out of there. So ideally you do your massage and then you put on your sleeve to help backflow so it doesn't backflow, or you're wrapping, and then it also helps with breaking down kind of the more firm tissue as well to soften it. Here's what the compression bandaging may look like. You can see they're applied in layers, and then starting at the wrist and the hand, and it'll move up. And this individual is on the severe case of lymphedema. Here's some examples of different compression garments. They've got the pattern ones now. They have the plain with the beige. This is a puffy night garment. So it's kind of like an oven mitt, for your extremity. And then they even have Velcro style garments as well.
And there, I've heard kind of two different things. That when you're wearing the sleeve, does that help move fluid, or is it more just acting like a dam, like preventing?
Gotcha. It helps subtly, not as much as the lymphatic massage and not as much as compression bandaging. But having the at least 20 to 30 milligrams of mercury, so that would be a class 1 compression sleeve, is helping, yes. Not as much as some of the other techniques that we talked about earlier, but it is certainly helping. And it's definitely preventing as well, if it's fitting correctly and all of those kind of things. Sometimes us lymphedema therapists get, anytime someone has swelling, they just start sending us people. So it's not always lymphedema. Sometimes it could be lipedema. So that is excess adipose tissue development, which can happen. I mentioned chronic venous insufficiency before. So your venous system is not able to pump that fluid, the blood and things back. DVT or a blood clot, maybe cardiac edema or congestive heart failure, malignancy or active cancer. We mentioned filariasis earlier, and then complex regional pain syndrome used to be called RSD, reflective, I can't remember what RSD stands for, because I've always known it as complex regional pain syndrome. But individuals have pain everywhere, and they just feel swollen and painful joints, hot joints, things like that. Well, I might get on my soapbox a little bit here. I strongly believe that we need to treat an injured lymphatic system just like we treat any other injured tissue. We treat knees, sprained ankles with ice, a brace, elevation, whatever it might be. We need to treat our lymphatic system as well, as early as possible. So the ways we do that: manual drainage massage, compression, education, exercise, skincare. And then lymphedema warning signs, again, generalized achiness, maybe tingling, heaviness of the limb. The extremity might fatigue a little bit quicker than the other side. Maybe a bruise-like feeling. And then as an occupational therapist, I always have to also discuss the lymphatic system, and lymphedema can have a profound effect on our ability to do our daily activities, and activities that we find meaningful and enjoyable. If you're having swelling and decreased range of motion, decreased dexterity, pain, you're going to have maybe trouble reaching and dressing and doing some of those activities like dressing, bathing. Leisure activities, maybe exercise, weightlifting are a concern. Crocheting and knitting, a lot of things with your hands and fingers. Walking with your lower extremities. Playing with the grandchildren. I had one patient, I remember, came to me just in tears because their healthcare provider had told them that it was recommended that they shouldn't hold their grandchild, their new little baby, because they, weighed maybe 10 pounds or so. Okay, well, let's figure out how we can make this happen. Maybe we can add some treatment, maybe holding the baby while you're sitting, position with a pillow, things like that. So we can occupational therapists are expert at trying to problem solve and figure out how to reinitiate some of these tasks and mitigate some of the symptoms as much as possible. Return to work might be a concern for some individuals. Typing, if they are involved in heavy lifting or repetitive movements, things like that, well, maybe we can modify, maybe you can wear compression, and figure out different strategies, again, to mitigate some of those concerns. And then there's a tremendous psychosocial impact. It's well documented that persons having a chronic condition report higher incidence of depression, anxiety, concerns about quality of life. I've had numerous patients tell me that their lymphedema was harder to deal with than going through cancer treatment. And it sounds maybe even unbelievable sometimes, but it's true. It's very true. It has a tremendous psychosocial impact. I've had individuals say, this is a constant reminder of what I've lost, what I've gone through, those kind of things. So it's very important to address these things as early as possible. We could do a demonstration, but you already know. And then I would invite everyone to check out the Lymphedema Treatment Act. It's www.lymphedematreatmentact.org. This is a grassroots effort to try to get lymphedema supplies, garments, even treatment sometimes available for all individuals, not just those with commercial insurance, but most definitely for our individuals on Medicare. Right now, Medicare does not deem compression garments and bandaging supplies as durable medical equipment. They say that they are not medically necessary, and we know that that's not true. We are absolutely medically necessary. So we're trying to get that language changed so our Medicare folks aren't being discriminated against versus our commercial insurance folks. Any questions
Yes,
for me?
a few. What about I don't know if it's machines or what about the at-home type of machine treatment things?
Yes.
What can you say about those?
Yes, there are what's called technically a vasopneumatic compression pump is what it's called. Those are available, and if you're interested, we can certainly discuss more in detail and bring in even a demo or something too. How they act is they try to mimic what the lymphatic massage is doing. So it will kind of squeeze with air chambers to mimic that movement to help move fluid along. I heard one rep call it kind of like the dishwasher versus washing your dishes by hand. We know washing your dishes by hand is the absolute best. You can tell if it's dirty, you can get in there and scrub, you can find an extra spot and get that cleaned off of there, but sometimes we don't have the time, so we put them in the dishwasher and let the machine do it for us. So it's mimicking our hands. I'm classically trained, so I also think human hands are the best tools. Recognizing maybe there's a spot right here on your forearm or right in here. I have had lots of patients like them. I've had some individuals not, so it is a little bit subjective too. Some of the research initially is positive. We're not sure 10 years down the road because we just don't have that research right now. I classify them as a nice supplement to what individuals are already doing. It does not replace going to see your lymphedema therapist, wearing your sleeve, doing your manual lymph drainage, or whatever regimen you and your therapist have decided upon. But it is certainly available, and I encourage people to check it out and see if it's something that feels good and works for them.
And then as far as actually causing the lymphedema, I mean, I know avoid blood pressure cuffs, avoid shots in that arm, and I've heard, wear the sleeve if you're going to fly or travel, for a long period of time. But then I've also heard, oh my gosh, if you get stung by a bee, if you have to remove a splinter, if, don't wear your wedding ring, don't wear a watch.
Right.
And I guess I know it's a gray area, but, where do you fall in that?
Right.
Or where does common sense take over? I don't know.
Exactly. The difficulty is that there is, you said it, there is a ton of gray because individuals, once that damage or disruption has been done to their lymphatic system, they're at risk, but it doesn't mean they're going to develop lymphedema. So I can't say, yes, Jane is going to get it, and no, Bob is not. We just don't know. We do know that certain things seem to exacerbate, certain things seem to make the lymphatic system work harder. So my goal is, when I'm educating individuals, is think about those things you just mentioned about precautions and flying and reducing your risk for infection and things like that. Those are all, and weight loss earlier you mentioned, those are all ways to help your lymphatic system. So we can't say for certain that flying is that's gonna be it, that's gonna be the thing that does it. Honestly, we do not know. Individuals are so different. How your lymphatic system heals may be totally different from how my lymphatic system heals. think about when you're pregnant, and each pregnancy is different, and maybe you swelled with the first one and you didn't swell with the second one and things like that. So there's a lot of variability. However, we know that there are certain things that make the lymphatic system work harder. So blood pressure cuffs put constriction, squeeze down. Even sleeping on that affected side can decrease the flow, if you will. If someone has an infection, like a bee sting you mentioned, or a scratch, a cat scratch, a pet bite, or whatever, the big concern is infection, and that puts extra work on your lymphatic system. So that's where I educate individuals. The compression garment, the precautions, all of those things are trying to help out your lymphatic system as much as possible. And some of it is a little bit like a puzzle in trying to figure out what works best for your lymphatic system. And that's why seeing a lymphedema therapist is quite beneficial to be able to problem solve. They know what questions to ask, and we ask them in such a way that, depending on the words that you tell me, okay, yep, she's experiencing this with exercise, or he's noticing this when he stands for periods of time. So then we can problem solve, okay, let's figure out how to help the lymphatic system out during those activities. Does that make sense?
Yeah, it does.
Okay. Yeah, it's not, I wish there was more of a clear-cut black and white. There is some recent research done in the medical field too that talks about the blood pressure cuffs and things, and at least in the short term, they've said that they don't think that it really has an impact on actually inciting lymphedema, let's say. We don't know for sure. So much more research needs to be done on lymphedema and the lymphatic system than we have right now. Mm-hmm. And it is the rogue system that does not operate like our venous system. It's completely different. So we're still even learning more and more about it to try to figure out some of this stuff for our survivors. Great questions, thank you.